And welcome into To Our Health. And folks, we got really lucky this time. Sometimes we just get a superstar, and we have one today. And don't you be embarrassed, because I mean it. We have the new dean of our UAB Medical School, our regional Montgomery UAB Medical School. Yes, there is one, and there are only 3 in this entire state that are satellites of UAB, which is just world famous. So, Dr. Lou Lambiasie, thank you for taking your time out. I know how busy you are.
Oh, thanks.
And thank you for coming in, and you're doing something. You're always innovating something. This time, we're going to talk about M.O.M, M-O-M. What is that?
So, well, thank you for having me here,
welcome.
and thank you for those kind words. You're going to make me blush. But so, M.O.M is a Medical Outreach Ministries in Montgomery. It's been here in Montgomery for years and years, helping take care of our members of our community who are not insured to get access to health care. And they've been doing a great job providing mental health services, primary care, giving medicine to members of our community who might otherwise go without medical care. And so they've been really been stalwarts in helping our community. But one of the things that we've done with the medical school is the medical students were looking for an opportunity to become more involved in the community of Montgomery, to help and to give back. And one of the things that we did is decide to partner with M.O.M to open a Saturday clinic.
Wonderful.
Yeah, and we thought that was particularly important because there are a number of people who have jobs, they hourly pay, they don't get time off. And so if they have to take time off to see the doctor during the week, they may be without the ability to get paid, and that it might cause them significant problem. So what we've done is we've opened a Saturday clinic. We had the first one just several days ago, and we saw patients on a Saturday morning, 3 medical students, and my predecessor as regional dean, Dr. Wick Manny, who's just an amazing doctor and human being, went and saw a number of patients, and we plan on doing it monthly for the next little while. Hopefully, we'll be able to do more than monthly, but the next one will be September 17th in the morning, on Saturday morning at M.O.M. And hopefully, this will become a very successful thing, and we'll be able to expand on it.
Now tell me where, if I wanted to go there, where is the location so that our audience knows where to go?
Yeah, it's on Carmichael.
Do you need to make an appointment?
Yes,
okay.
Absolutely. We'll need to make an appointment, and they'll have so yeah, you have to have an appointment, and it's only for people who are uninsured. Okay. So you have to be uninsured, and also because of the nature of the clinic, everybody has to apply for the Baptist charity care program. Okay. The Baptist Health Foundation and Baptist provides a large amount of charity care to people in our community, and so to be eligible to be seen at M.O.M and also to get testing done at Baptist, you have to be a member of that program, and so you'll have to apply for that too.
But that is so wonderful for people who are not insured, for people who actually can't afford medical care.
Yeah.
And can't even afford medications.
Right.
And you know what? There's an amazing number.
Yeah, there are a large number of people who work and they have too much money for Medicaid.
Right.
For the state to help them, but they don't have insurance. And these ideally, we would like to help those people.
Well, I think it's wonderful that Baptists, that they give back to our community.
Yeah.
But I was going to ask you this, talk about giving to the community. You and Dr. Manny, or the nurses, are, for the most part, are these people that just, they're Baptist healthcare workers, doctors that may be retired or may still be working. Do they just, for the most part, are they benevolent enough that they just basically give their time?
I know the physicians at M.O.M are all volunteer. Dr. Manny volunteered his time. Certainly, medical students all volunteer their time. The staff that came to our clinic were volunteers as well. So, I think the nursing staff, for example. So I think it is a really remarkable thing that these people are doing.
I just think that right now we need things like this, because there's so much that's wrong and so much that's bad that I don't want anybody to ever give up on the milk of human kindness. It is still flowing.
Oh yeah, there's a lot that's bad, but there's also a lot that's good.
There's more that's good.
There's a lot more that's good.
Yeah.
And this is an example of it.
Well, and thank you for coming up with this idea, for being able to give back to us. And remember, if you know somebody who is in need of medical care and just cannot afford it, then go to the site on our screen. They can make an appointment. It will be no cost to them. So thank you to the Lord, thank you to you, thank you to all the people, and to Baptist in particular for the resources that make this happen. So thank you, Dr. Lambiasie.
You're welcome.
And we'll be right back.